Hello, my name is Jennifer Campbell. I'm a nurse practitioner graduate student at Auburn University. As a future nurse practitioner, I want to address fellow nurse practitioner students and practicing nurse practitioners on the issue of alcohol abuse in adolescents. Substance abuse is a growing epidemic in today's society. Statistics indicate that 1/3 of adolescents are consuming alcohol before their freshman year of high school. In 2015, 623,000 adolescents in the United States were estimated to have an alcohol abuse disorder. Each year, an estimated 5,000 adolescents die from the effects of underage drinking. Long-term effects of alcohol abuse result in an increased drinking intolerance, impaired cognition, developmental delays, illicit drug use, mental health instability, and a higher risk for suicide. As you can see from the image behind me, alcohol abuse among adolescents can cause catastrophic effects. In the image pictured, the adolescent driver not only caused potentially fatal injuries for themselves, but also caused potentially fatal danger for other drivers. Not to mention the strain on the parents and loved ones of the adolescent driver and the financial burden accidents cause. Alcohol abuse in adolescents occurs in every realm of society. In many instances, adolescents are acquiring the alcohol from home. With statistics indicating a large percentage of adolescents begin drinking prior to their freshman year, early intervention is essential. Education is vital to all segments of society to inform on the harmful effects of alcohol poisoning and overdose that can cause toxicity to the adolescent brain. So how do we as nurse practitioners aid in the cessation of alcohol abuse in adolescents? First, we start with the conversation early. For healthcare providers, screening for alcohol use aids in the course of care. Asking the simple screening questions. The National Institute on Alcohol Abuse and Alcoholism created a 2-step questionnaire to assess alcohol abuse at a young age. For middle school age, between the ages of 11 to 14, it is recommended to ask if the friends are drinking first, such as, do you have a friend who has drank beer, wine, or any drinks containing alcohol in the past year? Then follow with, how about you? In the past year, on how many days did you take a sip of beer, wine, or any drinks containing alcohol? For high school age, 14 to 18, it is appropriate to ask about the patient's use of alcohol first. Then proceed to the questions about the friends. The screening tools allow us as providers to start an informative conversation on the harmful effects of alcohol abuse on the adolescent brain, as well as screen for interaction with prescription medication, how it can worsen chronic disorders, and be the source of the presenting symptoms. The primary care setting creates the most likely opportunity to screen for substance abuse and offer for intervention. Research shows that even brief periods of alcohol use, education, and intervention can be effective in preventing adolescent consumption. As healthcare providers, it is our duty to implement primary prevention strategies for alcohol abuse in adolescents to include education on the harmful effects. When faced with adolescents who are abusing alcohol through the screening tool that we've implemented, secondary strategies are recommended for intervention programs. The goal of prevention strategies for alcohol abuse in adolescents is to focus on primary and secondary prevention strategies to avoid the tertiary complications. With a combined effort between the nurse practitioners that are practicing and the future nurse practitioners, we can make a greater impact to cease alcohol abuse in adolescents.